My name is Laura Marshall. Thank you for allowing me the opportunity to speak with you. Um, I'm just going to share a little of my family's experience with navigating community mental health services. I'm going to tell you about my middle son, who's currently 14. We started our journey with community mental health when he was a third grader. So he was 8 years old at that time. My son has a significant number of different mental health diagnoses, including ADHD, um, oppositional defiance disorder, reactive attachment disorder, and then there's some argument between whichever doctor you're speaking with as to whether or not pediatric bipolar actually exists. But he does have that diagnosis from one. What that looks like in our home is that days were just endless defiance. Every suggestion, something simple as please wash your hands with soap, please bring your clothing down so you can wash it, or we would wash it for him, brush your teeth, that sort of thing, would literally erupt into this aggressive episode. We dealt with daily anger and aggression, which often became destructive or assaultive. We literally had to remove everything from his bedroom. And even then, we didn't realize his closet shelving was removable and it became literally a weapon. Splinters of pieces of wood from things that he would break, structures and the walls would then become, items that he would throw at us and that sort of thing. The level of aggression constantly just kept us all at this base level of just trying to maintain safety. We absolutely tried to use community mental health in terms of their emergency response. You're supposed to call the crisis mobile line, and we were denied any help from that line on more than one occasion. We would call his therapist, we would call the on-call, and essentially what they always told us was call the police. And so that's when you're trying to maintain safety in your home, what else do you have as an option? You call the police. So because of the number of times that we had to involve the police, my son then started to have placements within the juvenile detention system. At one point, he was sitting in juvenile detention for 6 solid months. Make no mistake, there is no counseling or therapy available. It's child jail. And so they sit and pass away the hours. And you're forcing your child then into the criminal justice system. When I have been attempting since he was 8 years old to get help for his mental health and just was completely unsuccessful. It was a really sick feeling in my stomach every time I had to pick up the phone and call the police again. My employment was at risk until it got to a point where I had no choice but to leave employment altogether, to stay home and try to maintain a basic level of safety in my house. The constant level of stress ended up, at the age of 46, I had a TIA, so a mini stroke. That's not normal. I'm not blaming my son for that. It's just the overall stress level that we lived with just takes its toll on everyone in the home. So again, my son did qualify for the SCD waiver, the serious emotional disturbance. Services that we tried to utilize were in-home therapy, wraparound, CLS, and various others. At one point, despite trying to work with community mental health in the system, I was actually threatened with someone contacting CPS and reporting me for child abandonment when my son had been in a hospital placement, and they said, you need to take him back home. And I questioned that for the safety of the rest of the family members. They said, well, we'll call CPS and report you for child abandonment. So that is a very common theme that a lot of our families have experienced. So in conclusion, raising a child with severe mental and behavioral health challenges is beyond difficult in itself. Having little support, ineffective or no services, and trying to learn to navigate the systems while in the middle of crisis adds exponentially to the burden. Legally, our children and families are entitled to this care. Unfortunately, we have been denied, given misinformation about services, and even flat out lied to, with nearly every effort that we've made to try to get services for our son. So my son is now in the juvenile justice system. He's not a criminal. He is a youth with severe mental and behavioral health challenges. But the current system left me no option but to pursue police involvement, which results in my son now having a criminal record. Michigan needs to rebuild the mental health support system that's been dismantled over the last number of years. Funding absolutely must be provided for oversight and accountability to ensure that CMHs are providing supports and services in fidelity to the models that they profess to follow. Michigan needs to provide facilities with appropriately trained staff that offer both short and long-term residential placements. I'm not talking institutionalization. I'm talking get your children the help they need and let them come back home. I have been accused so many times of just wanting to get rid of my son. I have fought for him since the moment I met him. The last thing I want is my son away from me. But right now, he's in Cheyenne, Wyoming through a court placement because I couldn't get mental health help through community mental health organization in Kent County. We want effective treatments so that our children can return to our homes and have the hope of a meaningful future. Thank you for your time.
Thank you for your testimony. I just have a quick follow-up. So what do you think is really specifically missing? Is it long-term residential care and then wraparound? Like, what is it do you think would actually help children with SED? I know it's not an easy question, but what specifically could we do?
Well, everything is underfunded, obviously. So
I don't think your mic is on.
Oh, it's red. Now?
Yeah.
Maybe I need to move it. Is that better? Thank you. I'll get closer. So everything is underfunded right now. And so the CMHs are playing this dance of providing the very minimum that they can get away with to move children through the system. And so you see that there's not proper pay for the staff, which means that they never have staff, which means they're constantly trying to cut your services. So if CMH was properly funded and properly overseen, those services would be very beneficial if they worked properly. We've talked to a few people who have received them in fidelity to the model, and it worked great for them. So that's one thing. And also, yes, we need the residential treatment centers that are beyond inpatient stabilization, but provide a longer-term treatment model so that we're not just stabilizing and then sending home. And then, of course, the oversight and accountability to make sure that these places are providing the services properly.
Okay, thank you both for being with us this morning.